So hello, everyone. Welcome to this session about hand therapy. I will change the slide where I thought I could. Sorry. Works very well. So I'm Malin Regat. I'm an occupational therapist and I work at the Karolinska University Hospital in Stockholm, Sweden. So I just wanted you to, see where I am. So I'm working at the new and very nice Karolinska University Hospital, but I'm also affiliated to the Karolinska Institutet. And I live in Ekerö, and I'm almost next neighbor to the King of Sweden. This is not my house, it's his and his wife's. So today's session is about, I thought I was going to talk a little bit of how hand function is affected in different subtypes of myositis. I will also give you results from 2 studies that we made. And also in the end, I thought we're going to do actually some hand exercise. So I hope you all have something to do the exercise with. So what we have seen is that in poly and dermatomyositis, the grip strength is reduced. And we have seen that it's in the late phase of the disease, but we have also seen that it's already in the beginning reduced. We had in a study, we could see that women had approximately 71% of what is normal and men about 60%. And this reduced grip strength affected the domestic activities and quality of life. In inclusion body myositis, reduced strength in the finger flexors is common. And it also could lead to reduced ability to move the fingers because of that the muscle strength isn't enough to move them. Also the dexterity and fine motor skills is also reduced. We made this similar kind of study that showed that women had approximately 42% of what is normal and men approximately 30%. And that the reduced grip strength were associated to daily activities and also here quality of life. So we made a hand exercise study for people with PM and DM. It was a 12-week hand exercise intervention. We did measures in the beginning and in the end. And the to meet the expected grip strength improvements, we added on repetitions of the exercises every 5th week. This was a pilot study, so we wanted to see what the participants thought about the program, if it was feasible, and also maybe if we could have any effect on hand function and activity. So 11 really nice people participated in this study. They did almost every session that they were supposed to do. The exercise we're supposed to do 3 times a week. In the end, everybody thought that 30 repetitions in the end of the study or in the intervention were too time consuming and suggested less repetitions, but maybe more sessions a week. We could see some improvements on the group level on the 3-jaw pinch. If you can see my hand, this is the 3-jaw pinch. And we could also see some individual improvement in both hand function and activity performance. So we could conclude that the hand exercise program seems to be feasible to perform, but the design of the program needed to be further evaluated to offer improvements in both hand function and activity performance. So then we did a hand exercise intervention for inclusion body myositis. So we learned we needed to do another methodology. So we did a single subject design instead of this just before and after measurement, which means that you have a baseline assessment with repeated measures and also repeated measures throughout the intervention. The participants were supposed to do the exercise 5 days a week for these 12 weeks. And as we use this single subject design, the participants act as their own control, which means that we don't need to have so many participants in this exercise. So 9 participants agreed to participate in this study. This is examples of results that we had. So I don't know, I guess you see my arrow here. So there are 2 parallel lines, which indicates 2 standard deviation based on the baseline measures. So if 2 on each other following measure points exceed or decrease outside these 2 lines, you have like a true change. And the first one, you had a true change for the key pinch grip for the left hand. Of course, I do the left hand. And the 3 jaw pinch on this other picture that you have like 3 on each other following measure points. So what we could conclude from this study was that there were few improvements regarding hand function, unfortunately. But no one got worse, indicating that it is safe to do hand exercise. And again, we could have done this study better, but I guess that is what you learn when you do research. In the study, they were not only measured for hand function, we were also asking them to name activity areas that were related to the hand function they wanted to improve. And based on that, 6 of 9 participants improved in their performance or satisfaction in their hand-related activities, those activities that they were asked to name that they wanted to improve in the beginning. So I guess what you can say is probably that the function doesn't always reflect the ability in activities. So even though that the grip strength or the pinch grip strength had few improvements of the participants, the activities that they wanted to improve did improve. So talking about the hand exercise, I think it's important to do both mobility exercise and strengthening exercise. For poly and dermatomyositis, we have not seen so much limitation in the joints, but I would recommend that you check that the joints are still working. So maybe do the mobility exercise once a week and the strengthening exercise once a day. For inclusion body myositis, limitation in joint mobility may occur due to the muscle weakness. And in inclusion body myositis, I think it's important to do both, to do the mobility, both passively, that you actively with the strength of your muscles, but also if you cannot, it's important to help with the other hand passively do the mobility exercise. And I would suggest that you would do the mobility and strengthening exercise once a day. I guess it's always like this in exercise that you need to find routine to make it happen. I guess you all have to think what works for you. If it's possible to do it once a day. I think in my clinic, it's people say, well, I do it on Monday, Wednesday, Friday, but then they're feeling a bit bad on Monday and they skip the Monday exercise and do the Wednesday. And I think if you do it all days of the week, it's easier to maintain your routine. It's like brushing your teeth, you do it every day. So good, I was really fast. It was not supposed to go this fast, but I think we're gonna go through the hand exercise and I'm gonna see if you can see me while I'm doing it. And so this is the mobility exercise. It's best if you can you can rest your arms on a table so that you will focus only on your hands when you do the exercise. So I will pretend that my arm is on a table. The first, are you all ready? Starting with the exercise? Good. So we lift up the hand, we hold a little bit, and then we let go. We lift up. So this is the mobility exercise for the wrist. So maybe 5 to 10 times, depending on how difficult it is for you. So try to lift as much as you can and flex as much as you can. Good. So let's take the other hand. You ready? You lift. So and if it hurts a tiny little bit, it doesn't, if you can manage, it doesn't matter. It's not dangerous for you. Good. So that is the wrist. We're gonna go for the hand. So the first picture, we try to flex the joints on your fingers. So you try to just flex those outer finger joints. So try to have the knuckles straight and then stretch and flex. And this is a little bit also for the brain or the mind to decide that your fingers should be flexing like this. So you can also give a little bit support on the inside. It sometimes helps not to be so hard to do. Good. So let's take the other hand. So the two outer joints of your finger. And you can absolutely do this on the table, resting like it is on the picture, but I do this upright so that you can see what I'm doing. Good. So the next picture, we're still gonna flex the fingers, but now we're gonna focus on those two inner, closer to the hand. So what you're gonna try to do is reach with your fingertips as farther down in your palm as you can come. It's almost like when you're waving. It's like bye-bye, or no, hey, don't go. So flex the fingers. Good. So let's take the other hand. We try to reach with the fingertips as far down on your palm as you can. So this is also the pump. So if you're swollen in your hands because you have not moved, this is the pump to have the fluids going back to the body. Good. So those two that we have already made, the small joints first and the other one ends up with the fist. So this is what we're gonna and upward. So we flex all the joints we have in the finger, in your fingers and in your hands. And the reason why we divide this flexion, otherwise you can say that we could just do the fist and then we're all done. But if you have difficulties doing this, it's very easy to compensate, or you press up your thumb a little bit so that it seems like it goes well, but it does not really. So that's why we split this exercise in different movements. So now we have done the wrist and the fingers, and now we come to the thumb. And we're going to try to make circles as round as possible with the thumb and the index finger. And then the rest of the fingers that I'm not really sure what they're called in English. But so try to make them as round as possible, and maybe concentrate a little bit to just make them round. So speed is not what you're after. It should be quality instead. Make them as round as possible. Good, let's take the other hand. So as round as you can. And you're gonna see that these movements is gonna show up again in the strengthening exercises. Good. And the last one is that you should make like a, circle. So you first lift up the thumb up towards the roof, then out like you would grip something really big, like a jar, and then down to the little finger, and then up again, up in the roof, open up like a jar, and then down to the little finger. So it's almost like a circle, up, out, and down, up, out, and down. And we do the same with the left hand, up, out, and down, up, out, and down. So now we also have done all the mobilities exercises that you can do with your thumb. Good. For the strengthening exercise, it's important that you have something to exercise that gives enough resistance. And they have made exercise studies on RA, rheumatoid arthritis, and they used the Borg scale of exertion. And they have come to a conclusion that you need to be about on a rating on a 4 or 5 on this scale, so that the dough or the ball is hard enough to get any strength. Saying that, it's also important that you can flex the joints into the ball or the dough. So if you need to choose a harder ball or a dough, and you cannot flex the fingers or the joints completely, it's better to take a ball or a dough that has less resistance. And it's also very important that you don't overstretch your joints. It's very easy. If it's hard to do, it's easy that you just lose your joint. I have a dough. I don't know if you all have anything at home, so you can try, but I have a dough. So what the first picture is that you should squeeze and flex all your finger joints as much as you can, including the thumb, and exercise the fingers. And the reason I have chosen these different exercises is that these are the most commonly used grips that we use in daily activities. As I am an occupational therapist, the activities is my main focus, even though we do hand exercise. So flex. Let's do the other hand the same way. See that my time, thought I had lots of time and now it seems like I don't, but I will try to move it forward. The next picture is that you should again do the circles that we did before, but through the dough. So press through the dough or the ball that you have. If you have a sponge from your kitchen, you can use a sponge as long as it's enough resistance. So go through all the fingers. Good. And the other hand, same way. Remember to have them round as possible. I think in this, it's easier to lose your joint and you will just overstretch if it's hard for you. So try to focus to make them as round as possible through your exercise dough or ball. The next is that you will hold the dough and then press with your thumb, like as you do when you're holding a key. So that is the grip that we want to exercise. The ball or the dough on your index fingers and then press with the thumb towards the index finger. This is a grip that we usually use with a key, for instance. The next picture, you should press these 3 fingers together, the thumb and the index finger and the, I don't know, long finger, we call it in Sweden. This is also a grip that we use in daily activities, like pulling on your pants, for instance, or pulling in on a zipper. So this is a good grip to exercise. Good. And the same with the other hand. So thumb towards the 2 first fingers. And the last exercise is that you should, like we did before, press the thumb towards the little finger, but through the dough. So you have to lift up the dough so you get as much exercise or resistance as possible, and then press towards the little finger. Good. I think I will go to the next slide. It's so to summarize, it seems to be safe to do hand exercise. The studies we have done has shown some individual improvements. None decreased your hand function, but we need to do better studies, always do better studies. And I hope that you will do your hand exercise every day. So I say thank you. This is my family. And questions. And I think I have some questions in the Q&A. So the first, I don't know if you all can see the questions or not, maybe not. So Janice asks what do we need to do the exercise with. So a dough, maybe, or a ball, or some stress ball, or something that is soft enough that you can flex your fingers, but still with enough resistance so you get tired while doing it. Otherwise, you don't get the muscle strength. So Nancy also say with IBM patients who have a chronic hand weakness on an annual basis, how often should we do the hand exercise and how often should our grip strength be tested? So I think I would repeat and say that every day. I think it's good to do it at least once a day. And I understand that you have all other things that you need to do, and maybe if your activities of your daily living includes a lot of hand function, it might be better to use your hands in activities than do the exercise. But still, I think once a day is good. Can't say how often you should do it. In Stockholm, we have annual visits for the patients that we have. So they come once a year to check. But I think it's good to have a check so that you see how it works. But I also know that in the US you have other regulations on healthcare. And Janice say that you didn't show us the mobility or strengthening exercise look like. Should we squeeze something? Very confusing. I was hoping that you could see the pictures and see me while I was doing them. Otherwise, I think maybe the TMA can put it on the website so that you can see how it works. And someone else says, what should I do if I can't curl my fingers? So if you can passively do it, if you can with the other hand, flex your fingers, I would suggest that you do it. If they're too stiff and it has gone for such a long time, I wouldn't do anything about it, because it's better to then choose to exercise those grips that you have. And I would guess if you have IBM, you will have this kind of grip that your thumb can work to the index finger. If you can't flex the fingers and at all, it's just stiff, I would not recommend that you do it. It's not. But if you can passively do it, I would suggest that you do it so they don't get stiff. So the reason I thought that the mobility exercise for poly and dermatomyositis is that you don't usually need to do them, because the joints are, or the mobility in the joints are not always affected. So that's why. But if you have problems with your mobility, you can do it once a day. Yes, so yes, you can. Dennis, can we get this illustration into swag bag? Maybe someone else can answer that question. So Patty says, my left hand is so weak. Do I just do the exercises as best as possible? Yes, you do. And also maybe focus on those that you actually can do as much as possible. And Janice, I take it back. You showed us after you mentioned in the first slide. Okay, sorry. I have a trigger thumb, and I've had an injection of prednisone and will last. So the question is if your trigger thumb will get worse by the exercise when you had your prednisolone injection. So if you just had it, I mean, if you just had your injection, yeah, I would wait. But otherwise, I think it's important to still get the mobility so you don't get stiff. And then they ask about the copies of the slides, and I will be glad to share them. So I think my time is up, is it? I will check. What do you say, Aisha? Should I stop?
Yes, it's 4:30, so the session is over.
Yes. So I would be glad to share the exercise program if you want to. It's no problem. I think it might be already on the TMA website if you haven't changed it. So it might be there already. So thank you all for listening to me, even though I don't see you. It was, and I hope you enjoy the exercise. So.
Thank you so much. And thank everyone for attending, and please enjoy the rest of the conference.
Yes. Thank you.